Would you like to know how you can speed up your consultation and record it within 10 minutes for the LCA? You're watching the right video. Hi, my name is Dr. Erwin Kwun. Not too long ago, I sat the LCA and passed it first time. In this video, I'm going to show you exactly what you can do to speed up your consultation and to avoid some common pitfalls trainees make. A common pitfall is not to complete clinical management, and this is where a lot of candidates have got stung for the RCA, and that's where the performance is lower in clinical management. Having a good clinical management depends on time management. It all comes to good time management. If you're not managing your time well, then clinical management will suffer. So at minute 6, it's important that you transition from data gathering to clinical management. Many trainees are dwelling on data gathering long beyond 6 minutes up to 8 minutes, and then when they find out that they only have 2 minutes, then they rush through their clinical management and they don't have a very good clinical management plan, and this does show when the examiner watches or listens back to the recording. So if you want to make sure that you're completing your clinical management strong, it also comes down to good time management. You need to know exactly where you are in the consultation with respect to time. If you find that you're spending too much time on data gathering, analyze your consultation and ask yourself whether there are any questions that you could have not asked, because it does not help you to progress your consultation. You need to make sure that you have adequate information in data gathering to progress the consultation forward. Sometimes people want to get all the information and they dwell on data gathering too long. So at minute 6, it's important to transition, and when you're making the transition, don't forget what the patient told you about the ideas, concern, and expectation, and tie it back to your clinical management. Make sure that your clinical management is not a generic plan for anybody who you're seeing. It needs to be customized to the patient. It needs to be tailored to the needs of the patient. So if the patient has some concern about something, then you need to address that concern in your clinical management. That's how you're going to score well for clinical management and interpersonal skill. Another tip I would say is, if you're finding that you're struggling with your time management, then consider doing a phone consultation. In phone consultation, you might have more time to give your clinical management because you spend less time in examination. You could either examine the patient remotely, or you could just explain the examination and bring the patient to the surgery for that examination. But it's important that you justify the examination and the reason that you're bringing them to the surgery. Then you can focus on your clinical management based on your working diagnosis. You explain the patient what are the possibilities and what you will do after the examination if you find X, Y, or Z. So this is how you can actually make sure that you're finishing strong in clinical management. And the other thing is that you need to explain clearly to the patient what you're doing for your clinical management. For example, if you are prescribing a medication, then you need to go through the side effects, you need to go through what's the dose, how to take the medication, and if there's any problem, what the patient needs to do. So these are the things that needs to be done well for clinical management. Another thing is, if you're going to prescribe an antibiotic, you need to specify which antibiotic you're prescribing and to say clearly if it is within the local antimicrobial guidance, so that the examiner knows that you're prescribing safely. So you don't need to use any jargon, just say that it is as per the local guidance. So the examiner will understand what you're doing. The patient will also know that you're prescribing the right antibiotic for them. So I hope that you find these tips useful. If you're still struggling with your clinical management and not finishing within 10 minutes, please let me know down in the comment section what is causing that, you think, having analyzed your consultation and having sought feedback from your trainer. And I'm hoping that by just making these small changes, you will find an improvement in your management of time in the consultation. And things can take a little bit of time for you to get to the pace that you need, But most candidates, after making these tweaks, they find that they are managing to record within 10 minutes. Take care, everybody. Bye bye.